Yes, ma'am.
Thank you for confirming. Namaskar, sir. We will be starting our session, sir. Am I audible to you, sir?
What?
Sir, kindly unmute yourself. Sir, kindly speak once. Previously, it was muted.
See, can you hear me?
Yes, sir.
Audible?
Now it's audible. Yes, sir. Audible. Now audible, sir. We
Okay,
shall start our session, sir.
okay, sure.
A very good afternoon to all respected dignitaries, governing body members of RAV, Guru Janas, today's guest speaker, Dr. P.K. Sudarshanan, sir, scholars, Shishyas, and viewers who have joined us today in 2202's episode of Gyan Ganga, a knowledge voyage weekly webinar series. I, Dr. Jitika Duggal, on behalf of RAV, welcome you all for today's session. On the onset, we would also like to express our heartfelt gratitude and welcome our mentors who have always been there to guide, motivate, and encourage us for our sustenance of this series, Gyan Ganga. Respected Padma Bhushan Vaidya Shri Devendra Trigunaji, President, Governing Body RAV, respected Vaidya Shri Rajesh Kotecha Sir, Secretary, Ministry of Ayush, Government of India, respected Dr. Vandana Siroha Ma'am, Director, Rashtriya Ayurvedic Vidyapeeth, New Delhi. Let us begin the session by seeking the blessings of Lord Dhanvantari, Om Dhanvantaraya Namah. I would like to introduce today's expert, Dr. P.K. Sudarshanan sir, who is going to throw light on Bhaya Prayog Vicharam, topical use of drugs. Sir has done MD Ayurveda from Kerala University with specialization in Kai Chikitsa as well as Panchakarma. Sir is currently Chief Consultant Ayush Ayurveda Hospital, Palakkad, Kerala. Sir has professional experience of more than 4 decades. Sir has been part of CCRS Ministry of Ayush Government of India for more than 3 decades. Sir has retired as Assistant Director in charge National Research Institute for Panchakarma, Kerala CCRS, and as Director Research Vaidya Ratnam Ayurveda Foundation, Thrissur, Kerala. Now I would like to invite Dr. P.K. Sudarshanan Nair sir to proceed with the lecture. Sir, kindly switch to your PPT.
Are you audible now?
Yes, sir, you are completely audible, sir. We shall start with the PPT presentation now. Kindly share your screen.
Okay. My screen is also, can you see my visible my screen also?
No, sir, screen is not shared yet, sir. You have to go by share, sir, like we did before.
Can you see now?
No, sir, the screen is not visible, sir. The PPT is not visible, basically. You have started sharing, sir. It is not visible that you have started the sharing. Somehow it has got stopped sharing, sir. Again, share your PPT. Tap on the share button, sir. Yes, sir.
Now?
You have to minimize the tab, sir. Then we will get to know.
Are you audible now? Visible?
No, sir, sir, you are visible as a tab on the Microsoft team, but the PPT is not visible yet, sir. Have you started sharing, sir? On the left of the leave button, there is share button, like we did previously.
Hello. Okay, that share. Okay, okay, one. Now, are you full screen also? Is it visible now?
Yes, sir, it is visible. It is visible, sir. We shall start now the lecture. We can proceed with our
Okay.
further slides.
Thank you. Thank you.
Thank you, sir. Thank you so much.
Yagadi Sadadanushaktan Sheshagaya Prasudana Shesh Avsukya Moharati Dangatana Apura Vaidyaya Namaste. Most respected President of Rashtriya Ayurveda Vidyapeeth, Sarvasri Padma Vibhushan Vaidya Devendra Tribhunaji, respected Director of Rashtriya Ayurveda Vidyapeeth, Dr. Vandana Shirohaji, respected scholars, gurus, and my dear students. Namaskar. Today, our topic for presentation is Behiprayoga Vichara. Actually, this topic is not usually presented by scholars. And moreover, they were always giving importance to internal medications and the various aspects of disease conditions. But this presentation is mainly an overview of our treatment practice, especially external medications. So we will start this. Actually, from ancient period onwards, people used to apply medications, treatments externally for various types of ailments. Our home remedies also, there are so many home remedies are there. Whenever some insect bite is there, or some swelling is there, or some traumatic injury is there, usually our people, common people also used to apply some medications externally, and they were getting cured the conditions. So nowadays, a lot of advancement has come in these treatment programs, especially in modern system of medicine. In our Ayurvedic system of medicine, our acharyas have very extensively explained our these external treatment programs, and we were we are also extensively practicing in our day-to-day clinical practice this type of treatment programs. According to Ayurveda, there are diseases and treatment procedures were classified in different ways. Especially we know that Anta Parimarjana, Bihi Parimarjana, Sastra Pradhana, Pradhana, etc. After that, today we are dealing with Bihi Parimarjana in this topic. This Bihi Parimarjana or external application is very important in our clinical practice. Especially we know that in our Kerala specialties, which is worldwide accepted treatment programs of Ayurveda, the majority of the procedures were external treatments. And in our IPD level treatment also, when the patients are admitted in our hospitals, we are also treating externally. So we know that massage, all these conditions are external treatments. Of course, internal medicines are also given. but mainly focusing the external treatments in our hospitals. So let us see in modern knowledge what these external applications and how this mechanism of absorption of these medicaments and how we can justify our ancient knowledge with this external treatment with the knowledge that we know in the modern scientific knowledge. See, there are topical administrations are mainly applied over the skin. Drugs applied on the localized area of the body or to the surface of the body part, regardless of the location of the effect. And another one is transdermal application is there. That is not practiced in our system, but mainly in modern systems, steroid preparations, hormones, etc. They were applied externally and it will be spread to the systemic circulation. So let us see the absorption through the skin. What are the routes of absorption? Mainly two routes of absorptions are encountered. One is transepidermal absorption, and another one is transfollicular shunt pathway absorption. These are the two routes of absorption. Let us see what is the transepidermal absorption. In transepidermal absorption, mainly the mechanism of absorption is the diffusion method. Diffusion means we know that when two liquids of different concentration is separated by a transparent membrane, the higher concentration liquid will be absorbed to the lower concentration liquid. That is the theory of the diffusion. It may be due to through the transcellular or intercellular in our external applications. So let us see this diagram. Here you can see the route of drug absorption through skin. One is cellular route. That means there will be in between the cells there is a gap. Through that way, the medicine's effect or properties will be absorbed to the internal tissues, and through that the bloodstream also. And another one is you can see in the diagram that's transcellular route. So two routes of absorption is there, especially intercellular route and transcellular route. The diffusion between the stratum corneum and the vehicle depends on concentration. So I have already told that diffusion method, when the higher concentration and lower concentration, the concentration of the external application, which is in liquid form or suspended in a vehicle, that will be absorbed to the internal tissues through the diffusion. So the concentration of the medicine or the vehicle where these medicines are suspended is very important. So concentration is one aspect which is this deciding factor for the absorption. Then another one is aqueous or liquid solubility. So whatever medicine we apply, that should be soluble in the water and soluble in liquid. Another one is oil water partition coefficient. That is the formula is there that how much it will be absorbed and the rate of absorption is formula is there. The stratum corneum, that is the external layer of our skin, that is being a keratinized tissue, And this is behaves as a semi-permeable membrane when the medicine is applied over the skin and drug molecules are penetrated through the stratum corneum by the mechanism of passive diffusion. That is the way the medicines are absorbed to the body when we apply over the skin. So we can see that the stratum corneum is the major rate limiting barrier. So whenever this condition of the stratum corneum of the person to person or the condition to condition of the disease, that the stratum corneum will be different. So according to the condition or the thickness or the softness, there are so many factors. Based on that, the absorption will be vary. Rate of absorption will be vary. These drug molecules may pass through the stratum corneum to the deeper epidermal tissues, and from there into the dermis, and from our blood circulation also it will be absorbed. See, when this drug reaches the vascularized dermal layer, it becomes available for absorption to the general circulation. That is the principle of external application of our medicines and the method of absorption through the stratum corneum or peripheral layer of our skin. Here you can see the diagrammatic representation where there externally the patch. Patch means the application of the medicine. Medicine is applied over the skin, and just lower we can see the epidermis. These molecules of the drug, which is slowly absorbing towards the inner layers, dermis and blood vessels, and that will be taken in the bloodstream. This is the diagrammatic representation, which shows the how these molecules of the medicines and with the properties will be absorbed to the body. See, another absorption method, that is transfollicular absorption. Transfollicular absorption means the skin is having certain type of appendages. We know that in skin, sebaceous glands are there, glands are there, hair follicles are there. Through these appendages, sebaceous glands openings, sweat gland opening, hair follicles, etc., the medicines and its effect and molecules will be penetrated to the internal tissues, and that is called shunt bypassing the transepidermal route. Transepidermal route we have already discussed, and that is through the diffusion method. Diffusion method is there, and here in this transfollicular absorption, the absorption will be effected through the appendages like sebaceous glands, sweat glands, and hair follicles. The basic principles of formation is initial transient stage shunt pathway will be predominant. When we apply a medicament externally, first the absorption will be through the this shunt pathway or the transfollicular absorption. When and at the same time the this diffusion method also, that's the intercellular absorption also will be going on. When the steady state has been reached, diffusion through the stratum will become dominant. And initial stage of administration in the first part, absorption will be through the transfollicular absorption, later diffusion. This is the difference is there. Anyhow, both ways of absorptions will be affected when we apply a medicament externally over the skin.
Okay.
That factors influence transdermal drug absorption. there are different factors are there which influence. That means it will speed up or that will decide how this is absorbed. Site of application is a very important. See, certain areas if we apply, that will be absorbed very easily. Whereas certain areas it will not be absorbed that much fast. Thickness and integrity of the stratum corneum and epidermis is another factor. Wherever more thickness is there, their absorption will be slow. And another factor is that size of the molecule. When the size of the molecule of the medicament, that is a decided. If molecules are higher size, larger size, it will not absorb as easily. Excuse me.
Speaker off.
Okay.
രണ്ട് വോയിസ് ആയിട്ട് കേൾക്കുകയാണ്. പിന്നെ ലാപ്ടോപ്പിന്റെ സ്പീക്കർ ഒന്ന് ഓഫ് ചെയ്ത് നോക്കാം. കേൾക്കുമ്പോൾ നോക്കി ചോദിച്ചു.
Is it audible now?
Yes, sir, it was audible. It was going fine, sir. Please continue.
Are you audible now?
Yes, sir, it is audible. Sir, previously also, sir,
Any
it was audible.
echo like I feel something.
Not much, sir. Not much, sir. It was finally audible.
Okay.
The participant can raise their voice. It will be rectified. Kindly, please don't disturb the lecture. Just raise your
increase
yes, sir,
the volume.
Yes, sir. Please continue, sir.
Shall I continue now?
Yes, sir. Please continue.
Okay. Right. Thank you.
Okay, sir.
We were discussing about the factors influencing the transdermal drug absorption. The size of the molecule. See, the size of the molecule is one of the deciding factor for the absorption. If larger size, it will be very slow in absorption, and the molecules are nanoparticle size, a small size, it will be absorbed very fast, and more effect will be there. And permeability of the membrane, that we have seen that stratum corneum is the superficial layer, and a condition of this stratum corneum or that superficial layer's thickness and other factors, whether it is hard or thick, thickness is more, that also is a deciding factor which influence the absorption. And state of skin hydration. When the skin is having softness and hydrated, or if it is very dry, so we can see certain areas skin part will be very dry. There, if we apply medicines there, it will not be absorbing as easily as where there is softness is there. Another important factor is pH of the drug. The pH of the drug and the skin and the skin's pH is there. If it coincides with both the pH, then only will absorb. Drug metabolism by skin flora. In skin, we can see there are a lot of microorganisms which metabolizes the medicines which are applied also. So the drug metabolism by skin flora is also considered as a factor which influences the drug absorption. Lipid solubility, we already said that aqueous and lipid solubility is a very important factor for the report of the drug in skin. How much quantity of the drug is applied and what is the thickness. That is also deciding factor. Alteration of blood flow in the skin by additives and body temperature. When the blood flow is less, that area absorption will be less. And the temperature is also one of the deciding factor. When if the application, if the medicine which applied is very cold item, that will not be easily absorbed. Where it is some having warm, it will be absorbed easily than the cold items. Then skin thickness and the amount of blood flow that we have already seen that, especially in the plantar and palmar areas, if we apply, it will not absorb as easily as the other part of the skin. So the skin thickness and the amount of blood flow in the skin is also a deciding factor for the absorption. So we will see the advantages of the topical delivery route. See, compared with our internal medications, Sandha Parivardanam, internal administration of medicines. The external administration of medicines have some advantages. Important advantage, we can say, elimination of fast metabolism. See, if some medicine is administered internally, it will go through various type of metabolic activities. It will be joined with the digestive juices, and as per our system, Rasa, Guna, Virya, Vibhaga, Prabhava, all will have deciding factors for the when the effect of the drug is done. So in this country, in these external applications, first pass metabolism is not applicable. So when body it is applied over the body, that effect will be directly work in the body and will have the effect also. Then sustained drug delivery also will be there. It is continuously that will be going and not in a part by part or will certain time it will be there. No. When it is applied, till the effect will be there. Reduce the frequency of administration. So these are the frequency 2-3 times like that. It is not enough. Once it is applied, then it will give the effect at the same time. Then reduce the side effects. Side effects are not there. So if we take medicine internally, there will be allergic reactions. Some other gastric disturbances will be there, and some other side effects for certain medicines have certain side effects. Different type of side effects will be there. But this type of side effects are comparatively less. But we have seen certain side effects in certain conditions. Some skin sensitivity is there. Certain external applications have made some rashes and such complications also. It is there, but it is reduced compared with internal medications. Improved patients' complaints. Patients are well satisfied and they will accept it. Usually, the external applications, patients will be accepted. So these are the things usually in modern system of medicine, and with the light of modern knowledge, this is the mechanism of action is there, and what is the information available from modern knowledge. So let us see about the what Ayurveda says and Ayurvedic approach. So we know that it is a Behit Parimarjanam. It is mentioned extensively. That's very detailed descriptions are available in our textbooks, our classical textbooks also. Taraga Susrada, Kava Pragasha, Sargadara, all the textbooks have given detailed descriptions about this type of treatment programs. So the Acharya says that Behis Parshana Masritya Abhyanga, Sweda, Pradeha, Parishega, Unmardana, Ramaya, Ramashti, Tats Behi Parivarjana. That is the definition of Behi Parivarjana. Behi Parivarjana means Parsha Masritya. Especially we know we are applying these medicaments over the skin. Skin is the sense organs of sensation. So it is basically the Parsha Guna, or the effect of the medicine are mainly worked based on the sparsha guna. So it is having most importance. Vehi sparsha masritya abhyanga sweda pradeha parishega udvaradhanadi ramayan pramashti tad vehi parivartya. And another definition is that Bahyada Shuddhigaram Veshajam. It is a transdermal purification. We know that when we do the Shodhanat Lisa, internal purification is there. For internal purification, by the cleansing procedure, we do the Snehapana, Vedana, Videdana, Vamana, all these Pajarma procedures. So that's we can say that it's a transcellular purification. Transcellular, from cells, internal tissues, cells and internal tissues are purified, and doshas are eliminated through our natural openings. Here, in this is also a external application also having some effect in the purification of the body. That is done through the transdermal purification, through the skin. That purification is done. The other internal purifications, natural openings will be the outlet for elimination of the doshas, whereas here skin is the organ where this purification is done. That's why it's called a transdermal purification. Bahyada Shuddhikaradam Dhigaram Veshajam. So it is also classified into three types. It is Apakarshanam, Prakriti Vigadam, Nidana Tyagascha. See, Apakarshanam is a Lagana treatment, that's different. And Prakriti Vigadam is Samshamanam type. Samshamanam Tad, Bahya Abhyanga, Sweda, Pradeha, Parisheka, Unmardanadi. These are the Prakriti Vigada treatment explained by our ancient acharyas. So, Apakarshanam, Prakriti Vigadam, Nidanatyaya. So, among these three, Prakriti Vigadam or Samshamana type of treatment is the main procedure or main part of our treatment. What are the Ayurvedic procedures encountered in our external treatment programs? So mainly we know that Abhyangam, the full body Abhyangam, is one of the external treatment which is extensively practiced in all the hospitals and everywhere. People knows about the Abhyangam or body massage. That is an external application. And Svedana or different type of fermentations are there. In Ayurveda also, in our system also, Svedana is an important chapter is there. Snehavanam, Svedana. Svedana, all the Svedana procedures are external only. So Nadi Svedana is there, Uvanaha Svedana. All the type of Svedana are external treatments only. And another type of treatment is called Lebanam, external application. Medicines are made paste and that is applied externally for a particular effect. And another one is Upanaham. Upanaham is also some sort of Swedanam. That's the poultice that is locally applied, especially in the joints and some other areas where there is Swedanam is the basic thing, and medicines are made into paste. Different properties of medicines are used, and that will be applied and packed well to self-generated heat will be there. That is a sort of external application. Then Unmardana, that is also some sort of Abhyangam or external application. Then Udvartana. Udvartana is a very important treatment for especially in neuropathy conditions. It is mainly practiced. And Udvartanam, Gavagaram, Medasa Pravilayanam, Sthirikaranamangana, Tvaprasadanam. So these we know that it is also an important treatment. These are also all are external. These are the important procedures only mentioned here. So many other methods are also in practice. So we will see when we can do this Bhagya Acharya have mentioned, described the time or when we shall apply. Anda sharire samshuddhe doshe tvamsa masrite. Anda sharire samshuddhe doshe tvamsa masrite. Adi dova alpa doshana kriya bahya pravachyade. The residual doshas localized in tvak and mamsa after Shodhana therapy. See, when one person is undergone Shodhana therapy, and after the Shodhana therapy, sometimes the doshas will localize in Tok and Mamsadhadu. In such a condition, to remove that dosha also, external applications have a important role. Another one is that Adidova Alpa doshanam kriya ahya pravachide. That means at the initial stage of the condition, where the doshas in mild stage. So initial stage, sometimes the Shodhana therapy will not have any role, or it is not possible to give in the initial stage, or it may not be necessary in the initial stage. In that initial stage, doshas are in mild nature, then it can be cured. The condition can be improved, or disease condition can be cured by these external applications. So, Vakya Prayoga are prescribed, especially in after the Shodhana therapy, the residual doshas are localized with Toka and Amsadhadu, and whenever these the doshas are in mild stage, these Vakya Prayoga have relevance. See, according to the properties of the medicine, which we use for external application, we can classify them as snigdha and rucha. So, majority of the treatment procedures, external procedures, are snigdha prayogas. So we know that Abhyanga, all these snigdha prayogas are there. And at the same time, Rucha Prayogas. Snigdha and Rucha are two aspects. So Sneha or Snigdha Prayoga, we can say Abhyanga is a Snigdha Prayoga. Potala Sweda and Pinda Sweda, different type of Potala Swedas are there. Patravinda Sweda, Jambira Pinda Sweda. So many types are there. And Shashtika Shali Pinda Sweda. So these are all external Prayoga, but it is also having snigdha effect, sneha effect in there. That's what purpose of Brahmana or sneha. And kaisega, pidichil. In Kerala we say pidichil. Kaisega means the whole body medicated oil is poured at the same simultaneously to gentle massage. So that treatment produces snehana effect and swedana effect at the same time. That is the whole body procedure. That is a snigdha prayoga used externally. Then Murdhadaila. Murdhadaila, uh, see, Abhyanga Sega Pijavu, Astis Chalada. What types are there? Abhyanga, Shiro Abhyanga, then Segam. Segam means Shirodhara, Shirodhara, Shirovasti, then Piju. These are all external applications in head. So Murdadaila, apart from this daily application of oil is also our in practice. Daily oil, Abhyanga Madhire Nityam, Sarjarasana, this is used. And especially that should be applied in Murtha or Pada, it is also prescribed. And Kadivasti is there, especially not only in lumbar area, that is applied in the Griva area, or in the Januvasti is there, Grivavasti is there, Kadivasti is there. Wherever the oil is kept for a certain period of time, that is called Kadivasti. And Tarpana. Tarpana is applied in the eyes. Netra Tarpana. These are all Sneha Prayogas. It's coming under the category of Sneha Prayoga. What is the relevance and properties of Sneha? So here we discussed that these are the treatment procedures of Sneha, but how this Sneha will be affected, or how this is possible to cure the diseases. So, Sneho Abam Guna Vishesha is mainly Jala Bhudam, is the important content of the Sneha. And Pridhi Ambu Gunabhuishta Sneha, Yesya Kledane Shakti, Saha Stigha. Kledane Shakti is very important because we have already seen that externally when we apply, the skin becomes soft. That softness of the skin is very, very important. So this application of Sneha will make this skin very soft. Then it is easily to absorb the properties of the medicines. And Sneha Mardava Krit, Nikto, Vela Varnagara Tatha. These are the properties of Sneha itself. And that Sneha is giving the desired effect, what type of diseases and what is the purpose of our treatment, that will be effected or given by these Sneha Prayogas externally. So another aspect we have to discuss is that we know that external applications are mainly these Abhyanga or Sneha Prayogas are used with a different type of tailas, different type. Abhyanga, Dhara, Murdaila, or done with Taila only. So, what type of Taila are generally in practice? The Tila Taila, Kera Taila, Erenda Taila, Sarshava Taila, these are in our practice. But especially, majority of our Taila preparations, we know that Kotajuka Tailam, Narayana Tailam, Dhanundara Tailam, Mahamasha Tailam, all these Taila preparations are the medium of or the vehicle is Tilataila. Tila is used. Tilataila is used. And the medicines are applied and that is prepared. Uh, Properties of the medicines are uh, taken to the basic uh, Taila. That is that Taila or Grida, whatever it is used, the properties of it be absorbed to this vehicle. Here, mainly external applications and Abhyanga, we use Tilataila. Then Kera Taila, Erenda Taila, these are also used. So, gingerly oil or Tilataila having a very important role in the external applications for the purpose of Nehana. You see, Tila means sesame seeds. It contains certain active principles. It is the sesaminone and sesamin. These are the active principles, basic active principles. Sesaminone is antioxidative activities there, and another one is hydrophobic. This effect of these gunas or active principles also will work when this is applied externally. See, the guna of tila, tiladaila mentioned or described in our classical books is like that. Tailam soyonivаттatra mukhyam tishnam vyavaija. It is having tishna guna and vyavayi guna. And Togdoshakrita Achakshyam Sushmoshnam Kavagrandaja. The Tiladaila is having Krishna Guna, Vavai Guna. So when we apply externally or when we use for massage or for Murdadaila or whatever it may be, the Tishna Guna and Vavai Guna will easily use for the penetration or absorption to the internal tissues. And that's why we use mainly Tilataila. But here we know that it says that it is not good for tok. We are applying over the tok. Then there will be a confusion. Why this tok dosha krit? Then why this Tilataila is extensively used or prescribed for external application? That we cannot. We know that whenever there is a skin disease is there, when there is a health of the skin is impaired, there Tilataila cannot be applied. When skin disease, wherever there is some skin disease is there, that area Tilataila cannot be applied. That will aggravate or will go for flourishing. So flare up. So Tilataila cannot be applied in skin disease conditions, whereas in normal skin for Abhyanga or other external applications, Tilataila is the best one for the choice. So it says that we have already said that samskara sarvarogadit. Samskara means what the properties of the drug which is used during the preparation of the taila will decide what will be the action of this drug. Properties of drugs will be absorbed on preparation with taila and action in the body accordingly. See, another important taila we use in our clinical practice is medicated coconut oil. Coconut oil is very important. It is having active ingredients or component is monolauril. It is having different action, especially antimicrobial activity. And another important action, this antimicrobial activity is done by the by disintegrating the lipid membrane of lipid coated bacteria. The lipid coated bacteria's lipid membrane will be disintegrated by the activity of the monolauril. So that is the mechanism of action of our coconut oil when we apply externally, especially in disease conditions, skin diseases where there is infections are there, infective conditions or eczematous conditions, eczema and some other conditions, the coconut oil preparations, Kerataila, especially we know that Dinesha Geram, Nalpamaradi Geram, Durvadi Geram, Uvavalmajadi Geram, the externally whatever we use in our practice are all Keratailas, not the gingerly oil preparations. So coconut oil is also externally for application is important. And it is also having bactericidal activity also. And cellular studies have also shown that monolaurin exhibits antiviral and antifungal activity also. So we can see it is antibacterial, antiseptic, and antiviral and antifungal activity. So these are all external applications where there is skin conditions. Their coconut oil is mostly preferred. The properties of Naligera Taila is explained in our textbook also. It says that Naligerodbhavam Tailam Brahmanam Velavardhanam Keshyam Pittanilaharam Madhuram Tesapagayu Hridyam Rityan Navam Proktam Puranam Guruvadanut Tiktam Suhridyam Madhuram Kandu Pushtaharam Param Kandu Pushtaharam Param. That is important aspect for during the external applications. Savadvagarasam, Ektabittagram, Avanasanam. Let us see the externally doing the Abhyanga and its relevance in the treatment. When dosha or vada is localized in Tokgada, Pada, what will be the symptoms? When the vada is localized and stands in the Tok Krucha Spudida Sutta Krisha Krishnascha Tudyade Adangyade Sarogascha Parvaru Tokstide Anile. So see that Tok Krukshada will be there. Pudida, Supta, Krisha, Krishnascha. That's discoloration and different type of pain conditions. So in these conditions, we can see that Vada is localized in Tok. And in that condition, what treatment can be given? Sweda Bhyangani, Chastani, Krityam Chandam, Togasade. When dosha is localized in Tok, the prime treatment which is advocated is Sweda and Abhyanga. Abhyanga is important. So this is the area where Abhyanga can be applied. Swedabhyanga avagahascha hridyam chanam togasride. This is the charaga. says that. Another aspect is Sarvanga Kupide Vade, Gatra Spurana Panjanam. When Vada is extensively or all over the body, it is making and certain symptoms are produced. Then Sarvanga Upide, Gatra Spurana Panjanam, Vedanavi Paridascha. In all these conditions, the treatment advocated is Sarvanga Bhubide Abhyango and Vastaya Sanuvasana. So, two conditions. One is when dosha is localized in Tok. Another thing, Sarvanga Vada, Sarvanga Bhubida also, this Abhyanga is having clearance. So, the external administration of oil massage, it is important, very important in Vada diseases, basically or mainly in the top, this externally top and in Sarvanga Vada. Another relevant or application is that Thailam Sankujide Abhyango Masha Saindhava Sadidam. The Thailam is used for the Abhyanga when these doshas are in Sandhi. Sankujida, that's where there is some deformities there in joints. There also Abhyanga is having relevance. Bahya Abhyantara Snehe Asti Majjagadam Jayed. Bahya Sneha and Abhyantara Sneha. Bahya Sneha is the application of different types of oil. And that also important. Asti Majjagada Vada. This Abhyanga or external application of oil is having relevance. See, the relevance of Sneha, why say this? Vada. See, Sharira Janam Doshanam Kramena Paramaushadam Vastir Virego Vamanam Tada Tailam Kridam Madhu. The Taila Prayoga is very, very important for Vada disease. And Vada Syovakrama Sneha Sweda Samshodanam Mrdu. There also Sneha is having importance. And Abhyanga Majare Nityam Sajarasrama Vadaha Drishti Prasada Pushtiayus Swapna Sutokta Datyakrit. There also Abhyangas having importance. So daily Abhyanga can be done. External application of so will. And see, Sharira Doshana, the Vada predominant, all the Vada predominant conditions, oil or Snikta Prayoga is to be done, both internally and externally. So the Sneha Prayoga is having very much relevance in the treatment of diseases, mainly Vada diseases, and that is externally or internally. In Bhagya Prayoga and Yoga Marga also, there is 3 types of Yoga Margas are described. One is Bhagya Yoga Marga, Madhyama, and Asti Sandhi. Marga is there. So here, Bhagya Yoga Marga, Rektadaya Stokscha, Rektadaya Stokscha, Stok Asraj, Masha Vyanga Gandalaji Abudadaya. Durnama, Gulma, Sovadayo. You know, all these conditions, that is Bhagya Marga is described. And that type of Bhagya Yoga Marga, there also this external application, Bhagya Prayoga, having importance and relevance. So, in brief, we can say that Bhagya Sneha on dosha, it is Vadahara, it is Pittanibandha Vadahara and Kapanibandha Vadahara. So this is about the Sneha Prayoga or Sniktha Prayoga, external Sniktha Prayoga and its relevance and various aspects of the different Tailas. Now we are going to discuss about the Rucha Prayogas. I have already told that there is Nikta and Rucha, and here we are going to discuss about the Churna or the Rucha Prayoga. Among the Rucha, there we can say Lepa, Talam, Uvanaham, Udvartan. These are the procedures mainly used in the form of churna. That churna will be mixed with some vehicle and make a paste and apply over the desired part. Levam means prepared with the prescribed vehicle. The in common practice in Kerala, we know that there is Jalamayadi Levam, Nagaradi Levam, Rasnadi Levam, and Alpamaradi. These are some of the Leva Prayogas. And for Talam also, Talam means it is applied over the Murtha, Rasnadi, Kachuradi, these are the Talam. And Uvanaham also, Uvanaha Churnam is used for, and the Simolam, such preparations are used for Uvanaha purpose. And for Udvartanam also we use Volagulathadi Churnam, Tapaladi Churnam, etc. And another Prayoga is with Kashaya or Kwada, Kashaya Dhara, Sakradhara, these are used, and Kshiradhara. Then different types of Sweda Prayogas, commendations, medicated steam, Avgaham, Portali Sweda. So these are different types of Sweda Prayogas. Nowadays, there is companies are making liniments and ointments. They are widely used by the practitioners, which is giving some instant relief also. So these are the other procedures of Rucha Prayogas. So let us see the Levam. What Acharyas has told about these properties of these different types of Leva. The medicines that are in the form of paste and used for external application are called as Leva. So according to Susruta, different types are there. Aleva Adya Upakrama, Yesha Sarva Shobhana Pradhanadamascha. In different types of Shobha conditions or edematous conditions or inflammatory conditions, Leva is prescribed. Aleva is the initial treatment which is common to all inflammatory swellings. So the synonyms of Leva are Lipta, Lebana, Leva, Aleva. These are different synonyms. According to different acharyas, you see, Susruta says there are three types of Leva. One is called Pralepa, Pradeha, Aleva. And Sargadhara also says three types, and it is classified, designated as Doshagna, Vishagna, Varnya. Vakpada says 10 types of, according to the action, according to the effect, it is classified as Snehiga, Nirvapana, Prasadana, Stambana, Vilena, Pajana, Pidana, Chodhana, Shoshana, Sarvanilagara. As these classifications are also described in our various acharyas in their textbooks. See, we have seen that Leva, one is Praleba. What is Praleba? Shida, Tanu, Abhishoshi, Vishoshiva. It possesses Shida Guna. Praleba is also Shida Guna, prepared with Shida Virya drugs. It is Tanu, which means very thin leva as that of Chandana applied to the skin. That is Shida Virya, and it is used very thin, not a thick application is there. Only thin application is done here, and that is called Praleba. Praleba is of two varieties. One is Abhishoshi and Vishoshi. Then another classification aspect is the Pradeha. Pralepa, Pradeha. Pradeha means Ushno, Ushnashidova, Behalo, Abahu, Abhishoshija. This Pradeha is used in the form of Ushna, whereas the Praleba is used in the form of Sida. Here, the Pradeha should be warm, heated, and it is used for Vadasleshma Prasamanam, and it is Shodhana Ropanam, Shobha, Vedanabham, all these conditions, Pradeha is prescribed. Praleba possesses either Ushnaguna or Shidaguna. Ushna Pradeha is meant for Vata Kabhaja disease conditions and Shida Pradeha for Pitta Rektaja diseases. That is the difference. We see that even if it is Leba, Praleba is there, Pradeha is there. And another one is called the Aleva. Aleva variety of leva is that which exhibits the mixed characteristics of both the praleva and pradeha. It is neither applied too thin as praleva nor applied too thick as pradeha. The application will be of medium thickness. So, based on the thickness, it is classified, and according to the action also. See the aleva is sila, and it is used for uh, Rekta Pitta conditions. And this Pradeha is Ushna. It should be warm, it should be thick, and it is for Kapha predominant conditions and different inflammatory conditions. And it is very important part of external application. How it should be applied. Tatra Pradiloma Malimbe. When we apply the pralepa or external application of lepa, Pradilomehi Samyak Aushadhi Avadishtade Anupravisyanti cha Romagovan Sweda Vahivischa Siramukhe Viryam Prapnodi. Paste should be applied in the direction opposite to face. So when we apply, we should when we apply from the down to upwards, then that is against the hairline, as we do in the Udvartanam. Udvartanam always Pradiloma. We do the against the hairline. The Pradeha or this leva also should be applied in that aspect. Thus the drug stays well, enters the hair follicles, and virya permeates through the sweat carrying. We have already seen in the mechanism of action of these external applications, topical applications, the transfollicular absorption shunt pathway we have seen. So the sebaceous glands, sweat glands, and hair follicles are the openings through which the properties of the medicines are entered or absorbed. So when we apply our labum also, that principle should be used. The Acharya was well aware of this follicular absorption on that ancient period also. We can see some common preparations used, especially in Kerala practice. One is Ellan Nishadi, Levam. In Ellan Nishadi, mainly the main ingredients are Tila and Haridra. And it is used by boiling these medicines in milk, aradalam, or suitable vehicle, and it will be made into paste and it will be applied in the area where the disease condition is there. It's Vadarakta Shobham conditions. This Nishadi labum is very much desired and used. Another one is Potanjukadi. Any of them you have heard about this. Potanjukadi labum is also very extensively practiced in our practice. These medicines are powdered and mixed as paste in Chinjapatra Swarasam. Chinjapatra Swarasam, and it will be boiled and concentrated as a paste, and it will be applied over the specific area, especially joint disorders, joints, inflammatory swellings. In the initial stage of Vata Kapha predominant conditions, Amatvam is there. There, this Patanjali Thailand is having very much importance and very good effect is there. Kapha, 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 Vata Kapha, Shobha, it is used. And another one is Graha Dhumadi level. That is described in our text also. And this is usually made a paste in Aradalam or Dhanyamlam. And it is also used the Kabadika Shobham, where there is no pain, but swelling is there. In such conditions, Grahadumadi Leva is having good relevance. Another one is Nagaradilevam. Nagaradilevam is mainly indicated in Abhigadaja Shobham. It is made is a paste in coconut water or Aradalam or whatever suitable vehicle can be used. So it is also in our clinical practice. Then Jadamayadilevam is very well extensively practiced. It is a kalka of Beravluchadi Thailam, and that is in Aranala, Godukta, Erenda Thaila, whatever vehicle we can use according to the condition and the prescription of the physician. It is used for Vada Shobham, Vada Rekta Shobham conditions. And another very important and very popular preparation. This is not a leva, it is a oil preparation. It is prepared in the Murivanna. It is prepared in Kera Daila. Widely practiced one in various conditions like Marmabhigadam, trauma, injury, bhangam, all these conditions. This Murivanna is having very important role. Wherever Marmabhigadam is there or swelling is there, injury is there, immediately the Kerala physicians will prescribe Murivanna, which is very, very effective, very well used, and it is having very good effect also in that condition to relieve the complaints. Factors to enhance the absorption of external application. So we have already seen that part. The pH is a very important part. The skin's natural pH is 4.5 to 5.5. So the pH of the medications, medicines, or the paste, or oil, whatever it may be, should be very near to this pH of the skin. Then it will be absorbed properly. Otherwise, absorption will be not in a proper way. Then particle size, we have already said that small particles will be absorbed easily. So when we prepare the leva, the drug should be ground well and mixed well with the vehicle. If it is not made paste and the particle size of the medicines which we use for the preparation of the leva, that depends. If small particles, that will be easily. So when we grind well and when we powdering the drug, that we should be very cautious to make it very small particles. And another aspect we have seen in our practice is that when we use for external applications and localized applications, this, for example, Ksheerabala Thaila or Dhanvantaram Thailam. See, the Dhanvantaram Thailam, if we apply this more than that, Avartita Thaila will have more effect. For example, if we use the Ksheerabala 101 times, that is applied for area where there is pain. So immediately that pain will be relieved. Whereas the normal Ksheerabala Thaila, plain Ksheerabala Thaila will not have that effect. And for example, another thing we will use Ksheerabala 101 for Murtha Thaila also, for Talam also, for loss of, for headache, and if sleeplessness is there, 101 Avarti Thaila will be used. So Avarti Thaila will have a small particles, nano particles, not the bigger particles. That will be easily absorbed. Whereas the plain Thaila will not be that much easily absorbed. That we can ascertain from the effect and observing the effect of the medicine. The drugs for external application must be heated and applied with a comfortable temperature. See, we have already seen that the absorption will be more easily done when the temperature, that depends upon the temperature. The temperature is there or the medicine is warm, it will be easily absorbed. So, Upanaham, Levam, oil for massage, Kadivasti, Shirovasti, Kashayadara, all are used in a warm, not to the cold applications. And aqueous and lipid solubility of the drug is also to be ascertained. Nature of vehicle enhances the absorption. So nature of the vehicle for especially in labor preparations, dhanyamla, honey, amladravya, swarasa, decoction, or gomutra, all these vehicles have some effect, and these medicines are to be made paced with that vehicles. Accordingly, the treatment, the disease conditions will be cured. And then site of application, already said, enhanced absorption, soft skin, mucous membrane. Poor absorption, plantar palmar area. Skin hydration also. Body temperature and blood flow is also a deciding factor. So another, we briefly told about that's liniments. Liniments are topical medications, coolness or tingling applied to the skin to relieve pain and stiffness often associated with muscular ache. In muscular pain, localized muscular pain, even patients will be preferred, or doctors also will prescribe the liniments and ointments, which are available nowadays. The Dhanvantaram liniments are there, and some other Murivanna liniments and ointments are also available. It is easily to handle, and it produces some instant effect also. Liniment stimulates sensory nerves in the skin. This creates sensation of warmth or tingling, effectively distracting the brain from the underlying pain signals. Where there is pain, there is a pain signals will be there from the brain. That will be distracted. That will be that for some period it will be hiding these signals. That's why it is giving some instant effect for the relief of pain. So nowadays, this doctors also will prescribe, and patients are also will be satisfied with that type of medicines. Advantages of Bahya Prayoga, we already told now. Instant relief is there, easy to perform, increase peripheral circulation, improve skin complexion. Some Varnagara Prayogas are there. So certain medicines have for complexion improving medicines are there. And antiseptic, antibacterial, the Kera Daila, Kera preparations are there. And softness of skin will be provided by the Abhyanga and Tiladaila preparations. And cosmetic importance is also there. The leva, the Yeladi levam or such a leva are applied even for the face pack is there. For face pack also leva is used. Elimination of first pass metabolism, sustained drug delivery, reduce the frequency of water. These are also discussed earlier. Then we will conclude. When we conclude, just whatever we discuss will be in brief. We will say again that Bahya Prayoga have an important role in the management of diseases, and the efficacy of the Bahya Prayoga depends upon the properties of the drug and its method of administration. Medicaments for external applications basically either Snigdha or Rusha in properties. The properties of the vehicle used in the preparation of the medicine have an important role in its absorption. Since skin is the sensory organ, neurogenic modulation may be the primary action of the procedure. Because Acharya also said that is Parsanamasritya. There is the relevance. All the external Sneha Prayoga with the medicated oils in the form of Abhyanga, Sega, Biju, etc., mainly Vadahara. Then the medicaments applied externally produces its effect locally or all over the body according to the mode of administration. The medicines administered internally undergo Jadaragni Paga and gastrointestinal death, first pass metabolism. Then extensive, there are descriptions of so many Taila yogas. We know that there is Narayana Taila, Shirabala, then there are so many Taila yogas are there, and so many costly medicines are also used for the during the preparation also. We don't know its effect, the difference of action when we applied externally. Internally, of course, that will be there. But when we apply externally, what is the difference between a Ksheravela Taila and Dhanvantara Taila or Narayana Taila? That is to be evaluated properly, and extensive research is to be conducted to evaluate the efficacy of different type of tailas which is used, because the costly tailas are there, very costly tailas are there. So whether this cost is effective, cost effective in this disease conditions. Extensive research is to be conducted to ascertain the effect of important preparations used externally and to establish the mechanism of absorption of Ayurvedic formulation scientifically. So these are the this is the presentation I would like to say on heavy Bahya Prayogas. I hope that you have all listened. It will be informative. I hope so. That it is up to you. Thank you.
Thank you so much, sir. I have asked the query if somebody has. I don't see any query in the chat box. Meanwhile, if somebody has any question, then please ask away. Do you have any question? Sir, there is a concept of avarti tail, if I'm not wrong. Can you explain it again? Am I audible? Yes, sir.
Hello? Hello?
Yes, sir. Am I audible?
Yes, yes, audible, audible.
Sir, there is a query. Why not to use tiltal in skin diseases?
Not clear, not clear. Madam, you can speak.
Okay, sir. Am I audible, sir?
Yes, yes, audible.
So the question is, why not we use tiltal in skin diseases?
Madam?
Why don't we use tiltal in skin diseases?
In skin diseases, of course, skin diseases, external applications are prescribed. Definitely. I told you that the Kera preparations, this Gopal Pajadi, Dinesh Agaram, all for external applications. And the leva also use the Kanduvara levas are there. Different leva, the different Snigdha Prayoga also available. I told earlier. Skin diseases,
Sir,
in skin diseases, the Tiladaila preparations are
yeah,
not used.
yes,
Tiladaila.
yes, sir. That is the question, sir.
Tiladaila
That
is
why?
Pangdosha. If it is, if there is any disease condition or skin problems are there, if we touch with the Tiladaila, that will flare up. We in our practice also we know that we in psoriasis and some other eczematic conditions, if we apply our Tiladaila or our purpose whatever it is, that will make a flare up. Instead of that, we can use Keradaila. That will not flare up. That is the difference between Keradaila and Tiladaila. That's why you mentioned in our presentation.
Okay, sir.
Is it clear?
Sir, there was a term of avarti tail. What was that? Can you
Pardon?
please elaborate? Avarti tail.
It's not clear.
Sir, avarti tail.
Eh?
Avarti.
Avarti.
AVARTHI.
Ah.
Yes, sir.
See,
in my presentation, I told that if we use Avarti Taila for externally, that's what our experience also there. For example, I told you the 101 Avarti Shirabala or 101 Avarti Dhanvandaram. If there is a localized area, severe pain is there, immediately you apply this Avarti Taila. That is in the form of ghee actually, or 5 or 10 drops you just apply. It will give instant relief. Whereas the same plain oil will not be that much effective as this Avarti Taila. That is because the Avarti there will be nanoparticles. It will easily absorb. That is, I told to especially to focus that particle size is very important in deciding the action of the drug. Is it okay?
Okay, sir. Okay, sir. Any other queries do we have? Thank you so much, sir, for your insightful lecture. On behalf of organizing committee, I would like to thank PK Sudarshan Nair sir for delivering such an informative lecture. I would like to extend my sincere gratitude to our mentor, Padma Bhushan Vaidya Devendra Trigunaji, President Governing Body RAV, for his continuous support, guidance, and blessings. Thank you, our director, ma'am, Dr. Vandana Shiroha, who is guiding force for all the events at RAV. I would also like to thank Vaidya Rajesh Kutecha, sir, Secretary, Ministry of Ayush, for participation and encouragement in all our endeavors. Next webinar session will be delivered on next Thursday, that is 30 Jan 2025 by Dr. Jaydeep Purut, sir, on Luthavisha Chikitsa, Oshad and Pathya. Thank you so much, sir.
Thank you very much. Okay, thank you.